without waiting any longer, I would like to, yeah, I would like to introduce you to our last session, lecture session, and that will be led by, I believe everyone already know, our very first moderator at day one. So please welcome Dr. Edwin.
Okay. Hello everyone, sorry, it's me again. Hope you don't get bored with me. So this is I think will be the last lecture in this room. How about that? Happy? Don't worry, because tomorrow we have another schedule. So at this session, we will see the reflection on what we have been through on the past Monday, Tuesday, Wednesday, 3 days, and the future of One Health. And this will be brought by Prof. T, the head of the task force of One Health. And I think we should give Prof. T a big welcome to give this reflection on what have we done and what will be done next on One Health issue. So let's give a warm welcome to Prof. Tri Wibawa.
Yeah, thank you. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. Ada slide-nya. So once again, you have a very plain slide PowerPoint, and then I put it in this AI, and then they work like this. And then it is not mine. Actually, it is the AI of them. That one. Okay, that is for the disclaimer. So once again, after you are discussing, you are listening the lecture. So now I think this is the message, right? Integrating human, animal, and environment resilience. That is very important. Please, lanjut Pak. Okay. This is the law. This is how we going to act using One Health approach. Very small here. Yeah. The interconnectedness of domains. The health of one is intractably linked to the other, meaning that we now open our mind that if you are working in the animal side, whatever happened in your sectors must be connected with the other sectors. You are the one that is the primary trigger, or actually you are the result of something happen in the human side, yeah, or in environmental side, right? Like we cannot blame. Like it is going to be the responsible of the animal side, or for example, I'm working in the animal side. I'm saying that it's going to be responsible for the human side, right? Though maybe when we are talking about the in our sectors, like I'm myself in the human sectors, whatever the result will be in our case, right? I will talking about the cardiovascular disease now is increasing. The PPOK itu apa mas? COPD is increasing because of the pollution. There is a 9 trucks. Somebody died because of that, right? That is in my side. But of course, in animal side, sorry, Prof. I did not recognize you, sorry. And then in the animal side, of course, you should do the same thing, right? I have a wildlife that is really now threatening by the pollution of the plastic, right? The fish in the sea is becoming declining, and the result is because of they are starting to eat plastic, for example. Okay, and also the same thing, right? Lanjut. Now, this is the example that the interconnecting about this environmental challenge, AMR, emerging diseases, and pandemic preparedness. Actually, it should be in our mind, right? You have to embrace everything. Like if We are not happy with the hantavirus pandemic, for example. Just recently in the newspaper, right? Hantavirus, Nipah virus, another pandemic situation, emergency, public health emergency that might be happen in our countries. It should be we need to think that it is not all alone, right? And then these are the scope. We are not saying that the traditional paradigm is bad. No, but it's going to be better if we're using the One Health paradigm, right? Paradigm. This paradigm is new, and you already know that the scope and focus is different, operational model is different, and the solution design should be different also. It's going to be active instead of the reactive, for example. You have to forecast everything. If you have the deforestation process, then you will have spillover. If you have spillover, you may have pandemic threat, right? If you have many people, 9 billion people to be fed, then you need some plantation. And how can we have that plantation field if we are not going to cut the wood, right? Okay, because up to now, the biotechnologies still did not and still not happen that, not have capability to produce synthetic meat. So we have to plant the pig there. You have to plant the cow, cattle, chicken, whatever you want to eat, right? Otherwise, many people will suffering from starving because of that. Then it is going to be what circle that is end up to our health and animal health and also environmental health, right? And for example, Dr. Edwin is MD, right? He's also saying that I want to work with a plastic way because disposable is always the priority in the hospital. Is that correct?
Yeah, Prof.
Right. But you should think also that actually going to be so many garbage, plastic that is going to be what do you call it? Circulated among us. So there are different point of view, different of priority, and we have to make them in the middle, right? You are not compromise the health service that is need for the need the disposable plastic for everything, but you need also to think how we're going to deal about that. Okay, and then remember you are not alone. You are not alone. Dr. Edwin is not alone. Us is not alone. But other experts should be invited, right? Human health sectors, animal sector, social science, anthropologists, behavioral experts, social scientists should be invited also. Do you how do you able to solve this? Maybe economic expert also should be invited to share with us what will happen if we going to change our behavior, right? Okay. And the last thing here, I think, the check is there. Every what is it? Every cell is checked, meaning that there's no way that we're going to not included some part of us, right? So everybody have to contribute. Everybody have to contribute. The problem is how to communicate each other, right? Yeah, we need to use not our language, but we have to invent the common language for this animal, human, and environmental sector. Otherwise, they will not able to understand each other, right? Okay. Uh, maybe I want to share like this. Leptospirosis. It is our problem in human side, but it is also a problem in animal side, right? Okay. Then the animal expert saying that, oh, there is a rat, mice in the field. So they starting to eradicate, right? Mereka ditangkapi apa? They catch the rodent, right? They catch rodent, and then after that finish, because they think that this rodent is only the pest that is going to eat the rice plantation, and then the food will be and the production will be decreasing. Finish. Okay, but in the human side, right? They think different. There are rodent in the rice field. They are not thinking about how the rodent will affect the food production, the rice production, but they think that they are factors of leptospirosis. Okay, so the same object, the different sector thinking is different. One saying that this rodent is a pest that is going to jeopardize the production of the food, of the rice, but another saying that it's going to be one of the, what do you call it, factors. And then if they talking about, if they discuss among them, then this animal sector, agricultural sector will talking to the human sector saying that, hello, there are a lot of rodent. I have already catched all the rodent, but remember, the rodent may have pee in the soil. Please make sure there is no leptospirosis there. There is no leptospira there. So it is different thinking, right? And how can now we able to make these two people talking the same language in one problem? That's the way. That is the challenge among us actually. Okay, and then maybe the last thing is that I hope from this discussion in this class, summer class, from the different countries, then you will able to make a networking. Anybody working in education, working in research field, in community service, then please make a, what do you call it? Make a networking. And then I hope that maybe 2 years, 3 years, 5 years, or even 10 years after this, then you will become a pioneer in every place where you are working. I hope that the message is catched, and then after that you can develop other, and then maybe the next decade, maybe there's no fear about the One Health awareness. There's no fear about One Health is not accepted by many people, whatever, because we already know, we already understand. Then we think how we are working together, not convincing people, please think like this, right? But convincing people, please, now the time to working together. Okay. And then that's my slide. This is a kind of my slide, but I'd like to, what do you call it? Uh, hear from the student. What is your comment about this, or what is your experience? Meaning, here are theoretical thing, right? And please share among us now, from maybe from Bangladesh, from United States, Pakistan, Timor Leste, whatever. Who will share first, please? Silakan. From Indonesia also, maybe.
Yep. Can anyone share? It's about feedback
Uh,
on our course here.
we have understand we understand about the theoretical thing. Maybe you find something that is different or actually something else. Please, yeah.
Anyone? Okay.
Uh, Good afternoon. Thank you, Prof. Tri. My name is Nika. I'm my background is from NGO. So I think this is very. There are a lot of lessons from this platform. As I understand, One Health as an approach, it's not really. I think we're still learning how to adapt, how to apply it in the context of Indonesia. I wonder how this application, since our stakeholder very fragmented between decision makers in these sectors, and they have a lot of conflicting in their interests. Since I'm working in the community base, I always thinking how the good way to start this approach. Can we start from the bottom up process, community from community level, or should we start from the top down? Because maybe the political willingness can be a good way to start and integrating the sectors. So do we have a lesson from other countries? Because maybe in the context of developing country like Indonesia, which we still struggling with corruption and things like this. They don't want. It's not so easily sitting together.
Right.
How the best way? I'm still thinking how, because today, for example, Prof. Anis explaining about the data, which is still a lot of challenges in front. I'm questioning a lot of challenges he shared based on his experience working with Satu Sehat and the existing situation. But I don't hear a lot about how to improving this situation, because not only this in One Health approach, every time we talking about information system, it's always challenging in this part.
Yep.
Thank you.
Yep. Thank you for sharing. Yeah. Yeah. If I'm not mistaken, there are 2 points, right? The first is how we going to start, right? And then the second is how we going to make people think about that, right? Okay. Maybe other student want to ask or any comment or the same thing happen in your country, maybe? Please, yeah. Before other people will will give comment about your insight. Yeah, I think the best way is. Oh, sorry, please.
Yeah. Okay, thank you, Prof, and good afternoon, everyone. I just want to give the information about One Health regulation. I think
the government start to concern about One Health too, because from coordinating Ministry for Human Development and Cultural Affairs start to make or drafting the purpose Satu Sehat, purpose One Health, start or going to make a regulation about One Health. I think it is good for all of us, because for the government start to make a regulation, and we are here in the bottom, and all of academic or stakeholder start to spread One Health, semangat One Health apa ya? Yeah, One Health spiritnya. Okay, I think it's enough. Thank you.
Yep, ada kertas nggak, Pak? Yeah. So yeah, I think that's true, right? The best way is, of course, from both sides. From the top, you're asking about top or it is going to be top down or bottom up, right? Yeah, I think it's the same thing. I think you can just parallelly doing that, like Pak Asol saying that government has, like, for example, for the antimicrobial resistance, the National Plan of Action, and also WHO Global Action, they mention about One Health approach, right? Meaning that the One Health has been recognized by the thank you, by the people that is on top there, right? We think that One Health is really important, and then from the bottom, we now learn, if we saying that we are in the bottom, right? So we learn about that, then we trying to catch the opportunity that is given by the top management in global and national to do the One Health approach. That's the first thing, right? We have to do bottom up and top down. But if you, like in Indonesia, if you are learning about how we have the strategic planning for the vector-borne disease, not even one word they mentioned about One Health, right? So it is something that is strange, because for dengue virus infection, it should be really related with the climate change, right? Climate change may change the habitat for the vectors. In this case, is a mosquito, right? But they are not thinking that this mosquito should be what do you call it? Should be there's something that is more integrated to make sure that they are not becoming the vector anymore, right? So in that case, we need to say to the government or whoever going to make decision that please remember, your problem cannot be solved by yourself, but you need to see this problem using the One Health approach. So it is going to be from bottom to up and from top to down. Okay, is that true? Whatever. The problem is how to start it, right? How to start that one. I hope that it's going to be maybe 5 years or 10 years after this, we will becoming the person that is able to make a decision, right? You will be in the center part of the government, for example, so you will facilitate us to make sure that everybody listening about this One Health problem, right? That's from Indonesia, right? What about from other country? Maybe from, please, if you have insight about the One Health.
Thank you, Professor.
Yeah.
To talking for the Palestine, the relation between the human,
Palestine,
animal, and
right.
the environmental. there are many challenges facing Palestine because, Professor, Palestine facing occupation, and there are no enough for example, if I want talking today, because we talking about the air and maybe air pollution
Right.
increases. For example, the Palestine, the almost of the air or clean air that we can get it from Israel. So the large amount of the or a small amount we can get it from Israel, because that may increase the unclear or polluted air. This is one of the challenges that face us. This is according to the, for example, the air pollution also is the air. Sorry, I mean the water pollution.
Water
The
pollution.
water pollution. Sorry. So another things I talking it the challenges about the air pollution also, because almost of the almost of the country with Israel. So we live as a Palestinian in the small cities, and this is making traffic and a crowded city, and this is increase the air pollution by the air emissions from the cars and another things. So we cannot focus on Palestine because the political situation. But in for the Indonesian, I want to talking because I live here for 3 years, and
3 years
I
already.
see. Yeah, I see something weird here. Sometimes I see about the Indonesian habit. I want to talk about that because I see wastage of water in Indonesia. I see many people here like open taps and wastage a lot of water. And if he want like wudu and he open like taps and a lot of air wastage, and we know the wastage of water, it accommodate with the water pollutions, and this is make more burden on the government too. So I think to improve the one health between the environmental, it not depend on the on the government. Also, it depend mainly on the awareness of the population. So many population do a lot of things without aware this is wrong or this is correct. We can most of people do something like it's normal. Most of people do like that, so I can do it without care. So I think it's very important to increase the aware, because I see the most dangerous in this plant is the human, not the plant or not the animals, because we see the air pollution from the human. If I can say about the water pollution, also the human. So we increase the damage for the one health. So I think we need two more instructions and government laws to increase the one health for all. Thank you, Professor.
Yeah. So you just highlight that the problem is in the behavior of human, right?
Yeah,
That can affect everything.
Yeah.
We are wasting water. We are wasting everything, right?
Yeah, I see. Why I comment for that, because in Palestine we facing big challenges in water, and I see the people here like open the tap without care.
Sure.
Without
Okay.
care. Yeah.
Thank you to remind
Thank
everybody
you,
here,
Professor.
right? Because everything is centered in the human, right? Please.
Yeah, exactly.
The human behavior will affect everything, right? Is that your highlight? Okay, thank you very much.
Thank you.
Other from other country maybe? Ada yang lain dari? Is there any other person from Pakistan maybe, or Myanmar, or other countries? Maybe people that is also online before you, of course. From online. Yeah, silakan. Oh yeah, please, sure. Yeah, United States. It must be another story, right? Please, thank you.
Hello, everyone. I'm a current master's student at the Brown University in the United States. I guess the one thing I would like to add is that the US likes to specialize. So everyone is working for years in something that is so specific and so small. And I've actually never heard of One Health until now.
Oh, really?
And so in my master's program, I'm studying global health, but I also
Right.
take classes on environmental health.
Right.
And I'm one of the very few students that is trying to branch out of my concentration and learn more. So I think that doing this course, I'm really grateful that I got to see how everything intersects, because I think it needs to spread to the US now. The US is guilty of thinking that they are. We're guilty of trying so hard. Like, we spend 4 years in undergrad, and then if you want to do med school, that's another 4 years, and then another 4 years after that, just to do one very narrow-minded thing, and you lose sight of everything else. So, quick story. Originally, I was going to go, well, maybe I still will. I did undergrad in neuroscience and psychobiology. And so I learned so much about the synapse and the action potential of so it was such a specific, narrow concept of health that when I had graduated after 4 years, I thought to myself, what did I learn about healthcare? How can I go to med school if I know nothing about how to treat people and how to interact with people?
Right.
So that's why I'm doing my master's in public
Right.
health now. But yeah, I'm grateful for this. And I'm grateful for these perspectives and looking at how everything intersects, because it is so important.
Yeah, thank you. So I think it is very interesting, right? So it doesn't mean that people have to knowing everything, right? I mean, if you're in the med, then you have to learn about the synapse, potential action, of course, how to treat the human, right? But it doesn't mean that you have to learning about how to treat the cat, right? But at least we understand that somebody else really master in that part, so we can ask them to come in and please help us. That's the way we think, right? Because if you're still want to learning about to treat the cat, to treat the elephant, then it's going to be never-ending story for you, right? So please just make sure that you are mastering in your field, but you do understand other people, that is going to be helpful for us in that case, maybe, right? Is that correct?
Yeah, it's okay not to know everything. And it's a beautiful thing to be able to share with others and
Yeah.
learn from them,
Right.
work together. So
Thank you. Yeah. Yeah. Thank you. Next, maybe. Silakan.
Well, actually, you kind of already answered my questions.
Right.
To me, One Health paradigm is quite promising, but I'm afraid. My concern is One Health sometimes sounds quite abstract
Abstract.
if it's not a literally topic. But like how to make it come true, to translate it into reality, I think we should propose not only concept or model, but really break down like the role distribution, who doing what, like social scientists or the exact scientists, microbiologists. And that's what lead me to think about the, like the knowledge management, the dashboard, the one that you mentioned before. Like, you don't have to know everything, but I think we should learn each other to be able to speak to the same language.
Right.
We have to have like a kind of dashboard, a very good knowledge management system. So the people from the social scientists, like, for example, me, myself, I learned a lot from this summer course in the last 3 days, the things that I don't usually hear every day in my field. And I learned a lot from this. And I really hope, I expect that folks from the like microbiologist or the doctor could also learn like our field, not to master, of course, our expertise or knowledge, but to learn each other, to have like a knowledge management system and knowledge sharing. I think it's really important for One Health. And like the the breakdown of what can we do. So not only the concept and the model. I think that's
Thank
my
you.
thought.
That is more important, of course. How we going to start to implement? How we sure that we are not talking about a theoretical thing? Is that correct? Yeah. Okay. What I'm what I'm thinking is that actually the if you're talking about the implementation, then you need to go jump to the problem itself, and then like for example, you're a social scientist, right? Yeah, my I have research with economic expert. I have research with a pharmacy and also public health. In what? In how to understand why people come to the pharmacy and asking to have antibiotic without prescription, right? This is not my field, of course. This is I'm microbiologist like Dr. Redmond. And then what happened is that we need to understand why people asking antibiotic. And then we now know that actually people asking antibiotic is because they believe this antibiotic is able to cure everything, right? To cure everything, meaning that they have headache, then they think they need antibiotic. They have muscle ache, they think that it is need antibiotic. So they come to the pharmacist. Okay, then they starting to ask to the pharmacy. And then pharmacists think twice not to give to this person. Why? Because they think that if I refuse to give the antibiotic to these people, then this patient will go to another pharmacist. And then definitely they will give it. So why I'm so stubborn like this, right? Why I'm me the pharmacist, why I need to be stubborn not to give? Because other person will give. And then I will have no money anymore. I will not earn the money, right? But other people will, right? So many complicated thing, right? First, about the understanding of the antibiotic. Second, we're talking about the economic thing, right? And the other maybe many things, right? So in that case, Mas Edwin will not able to jump into to give intervention to that, right? Pharmacist doesn't have any clue how to educate the person. Maybe social scientists, anthropologists, or even economists, right? They need to come in and discuss about that because it is a problem. 70% antibiotic was dispensing from the pharmacy without prescription. It is true. Our research like that. And then behind that many complicated things like that. Okay. In Indonesia, we have pharmacy businessmen that have no pharmaceutical background at all. I mean, pure businessmen, right? So this is businessmen are having the pharmacies, and then what do you call it? Ahli apoteker apa? Pharmacist, yeah. The pharmacist as a professional, they are working under the businessman, right? So, though these pharmacists understand that the antibiotic dispensing without prescription will impact to the antimicrobial resistance, but they cannot refuse. Otherwise, these pharmacists or drugstore will collapse, right? And then if you're talking about the government, yeah, one's maybe thinking, why don't you just make this antibiotic like uh, like cocaine or sabu-sabu or other psychotropic drug? We just give very strict regulation, right? If you take antibiotic without prescription, then you will be punished, for example, right? We can do that. Can we? Can we? No, because people still need this antibiotic, right? How can you imagine that in the very remote area, right? Some one children or maybe people just have a fever and is infected by the bacteria. If they are not able to access the antibiotic, they will die maybe, right? So we cannot using the, what do we call it, the very tough regulation in that case, right? So many complicated, only one model, only one problem. So please, now you can just find other maybe 100 problem the same situation, right? Yeah. Okay. Yeah. Other insight maybe from other countries, other problem. Jamnya sampai jam mana, Mas? Cukup? Yeah.
Agree.
Or Prof, you want to comment something?
Thank you.
Pak Edwin want to comment something?
Me?
Yeah.
On this one online.
Oh, online. Yeah, please.
Or should I read it?
Gimana? Ada tulisannya?
Yeah, so writing.
Oh, sedang menulis. Oh. From University of Uganda. Okay.
Okay, there's a question from Esther Eunice Awari from Makerere University, Uganda. In Uganda, we have the National One Health platform already in existence. However, effective communication in the four ministries, that is health, environment, animal sector, and agriculture, is still a challenge. I believe if, as a country, we work on this, then we can easily protect the public from zoonotic disease and emergency of AMR. Thank you
Okay.
for
Yeah.
training.
That is very nice to hear about that, right? So the platform is there. I think all the countries already like that, right? And like in Indonesia, just somebody just mentioning about the platform that is provided by the ministry. And here in Uganda, the same thing. The problem now is how to make sure it is work. It is not only in the work on in the paper, right? It should be in the field in every cases. I think any other people that have the same situation in Uganda? Because we have actually, we know there is a regulation, there is a action plan, there is a people that is working there, but implementation is very hard because yeah, so many problems. Yeah, thank you for sharing from Uganda.
There's one more from the Philippines. Is it
Huh?
okay? One more from the Philippines.
Oh, the
Online.
Philippines. Yeah, please. From the Philippines, please. You can just open your mic if you don't mind.
Yeah.
Yeah, please. Yeah. Joseph, please.
Hello, hello everyone.
Yeah,
Sorry.
hello. I can hear you, please.
Actually, we have the local initiative about the One Health, specifically for rabies.
Rabies.
Yeah. So we formed the One Health Rabies program. Way back then, 2016. and we gathered together. We identified. We conducted stakeholder mapping, and out of this mapping, we identified the key stakeholders. We brought them together, and especially in rabies, we identified first the key players, just like the veterinary, human health, social services, and also we included the policymakers because we really believe that we don't have we cannot run a program effectively if it is not anchored in an ordinance. So we connected with the politicians, the policymakers, and alongside with it, we also introduced a digital platform. We called it as the Rabies Management Information System. So we've been doing the approach for more than a decade, and um, I guess it's doing well. The One Health Rabies program, and we started to be replicated to other cities and provinces in the country.
Thank you, Joseph, for sharing.
So I'm very
Yeah,
thankful that
please.
I was able to participate in this training course to UGM and the organizers. Thank you very much for being part of this training course.
Yep. Thank you. Well, you're welcome, Joseph. Thank you for sharing. Is there any other comment from the audience here for Joseph or the same situation will share? The rabies. Yeah, rabies is problematic also in Indonesia. Part of us, of course, not in Jogja, but maybe in Bali or in other part. Yeah. Yeah.
Professor, can I add a little?
Please. Yeah.
Actually, we know pretty well that one of the a limiting factor in every program is the funds. It's something to do with the financial
Funding.
aspect.
Yeah.
So, what we have done is that we created also a program cost recovery scheme for the sustainability of the program. So we collected minimal fees from dog owners and also
Right.
the animal bite patients.
Yep.
The very purpose is that to keep the program sustainable and not really relying much on the government funds.
Yep. Yeah. The funding is always being highlighted if you have a One Health problem. One approach because we do understand that maybe the priority is not there, right? I hope that from the next maybe the priority will be there. So the politician and other governmental officer will.
Actually, Professor, out of the funds we generated, we were
Mhm.
able to expand our bite centers, and out of the funds, we were able to give salaries to our additional personnel, and so also the procurement of needed materials, equipment, computers, just like that one. Thank you.
Yep. Yeah. Thank you for sharing. Yeah. Other comment maybe from other side. Okay, please open your mic. Satu lagi, one more from Nigeria. If it is possible, then please open your mic. Sharon. Good morning. Now we are in the morning. Yeah. Good morning. And we have made a word toward.
I don't think she will be
Good
open
morning.
mic. Hello.
Please, yeah.
Yeah, good morning. I'm Sharon Rumide from Nigeria. So in Nigeria, we've made efforts in implementing the One Health approach we have. different groups, different consortium that are making efforts to, have this integration of these sectors. So one that I'm part of is the African One Health Disease Prevention Network, which is ADAPT, that is in about 7 countries in Africa. So what we do is to bring in experts from different fields, microbiology, public health, veterinary medicine, in order to have, to understand the transmission and how this sectors can work hand in hand. So what we do is to understand antimicrobial resistance. We deal mainly on antimicrobial resistance to understand how the cross transmission of AMR and to know how we can strengthen the health system in Nigeria in order to prevent a sporadic outbreak of antimicrobial resistance. So we integrate the data from human, animal, and the environment in order to provide timely information that we can share, because our main goal is dissemination, so that we can share. And that makes me believe that having multisectorial collaboration and integrated surveillance will help in disease outbreak. It might not even be antimicrobial resistance. It could be any zoonotic disease, and this will provide effective response in order to deal with any health threats.
Yeah, thank you, Sharon. Yeah, the same situation in Nigeria, right? The zoonotic and AMR is the problematic, the same as in Indonesia also, and it is 2 of maybe 3 model or 3 sectors. So not 3 topic that is usually becoming very fit for the One Health problem. Thank you for sharing, Sharon. Is there any question from the audience here? No. Okay, then because of time, maybe. Thank you. Yeah. We need to wrap up this session. So please, Edwin. Yeah.
Okay, thank you very much, everyone, for feeding us some reflection on One Health summer course of the past 3 days. I think there's a lot of, I cannot summarize all, but I think there's a lot of feedback, good feedbacks on each countries, even from Nigeria. You have ADAPT, African One Health Prevention Program, that's good. And even from feedback from the US, which has not many people know about One Health, I suppose. And also from Indonesia, from the social science also, where knowledge management would be quite important for us also. And I think that all of this is a good feedback, right, Prof, on how we can handle One Health in the future. And I think this is the wrap up for this 3-day session. And I think thank you very much for holding this 3-day in this room, although it's quite cold, sorry. And yeah, and I think that we will give this one more chance to Prof. A big warm of applause. Thank you very much, Prof. And I will give back to the master of ceremony to continue on the program 2 days ahead. Thank you very much.